I'm Alexandra, Medical Communications Coordinator with Médecins Sans Frontières, and I'm based in Sydney. I've been working with Médecins Sans Frontières since 2002, and I volunteered in the Sydney office before that, so it's been a long relationship. My specialty areas: women's health, child health and sexual violence care, and I work closely with the medical advisors who cover those areas of care. I've also had the privilege of working with MSF project teams in countries such as Afghanistan, in Kenya, in South Sudan, South Africa and Uganda, and also to meet patients and people in those communities to learn about their lives and how we can help them stay healthy. Médecins Sans Frontières communicates about women's health issues because they represent some of the most basic and essential healthcare needs, but not enough women are getting access to that care. Depending on where they live, they might face barriers to getting contraception, getting access to maternity care, or to safe abortion care for an unwanted pregnancy. And they face the risk of dying because they do not have access to this care. Also, women may suffer domestic violence or sexual violence, and we know that overwhelmingly women are more likely to experience this violence than men are. And the other reason talking about women's health issues are important is also for the girls who do not have access to appropriate care because of their age. As a medical humanitarian organisation, we are always trying to adapt our setup and our care so that we can reach more women. And one of the ways we can do this is by integrating women's health activities or women's health care, such as contraception, such as sexual violence care, such as safe abortion care, into non-women's health programs. So programs like nutrition programs where women are bringing their children, or HIV and TB programs where they are coming themselves. But this way we can expand the offer of care at the same time and provide more care to women. MSF's care is free, but money is not the only obstacle for women. So we're very committed to community awareness activities, going out into the communities, sharing health messages, and encouraging people to come to us. But what we emphasize is not only that the care is free, but that it is confidential. And this is important in helping us develop the trust of women and girls, especially if they are seeking care such as sexual violence care or safe abortion care. Women need to have more decision-making power to keep themselves healthy and to look after their well-being. They shouldn't have to feel ashamed of their bodies and their sexual and reproductive health needs. So they need access to information, to health information, as well as healthcare in their community, closer to home, so it's more easily accessible for them. Time sort of stops for me when I remember a patient like the young woman I met in a wheel in our postnatal ward in South Sudan. She agreed to be interviewed to tell me that she had just had a stillbirth. She had just lost her baby. And actually she had also already lost her 2 previous pregnancies. And it's devastating that that is the story that a woman has to tell. Antenatal care is so important throughout a woman's pregnancy, and a woman should not have to wait 9 months to find out that there is a problem that could have been dealt with earlier or prevented earlier. MSF commemorates 50 years of medical humanitarian action in 2021. We are a much larger organisation now, responding to acute health needs in over 70 countries. In each of these projects, we have many local staff who are working to provide healthcare in our projects to their own communities. And it's their diversity that is our strength. And it's thanks to their contribution that we are going to be able to continue to adapt our humanitarian action so that it can be most effective in the years to come.